The University Carillon Church has started a program for people in the community. Here at Brain Wellness, we have folks who've had a diagnosis that leads to dementia, and they're in the early stage of that diagnosis.
We were here to conduct some hearing screenings for the Brain Wellness group, providing the students the opportunity to get into the community.
Today, we are doing cognitive screeners to see where they stand in terms of memory, visual-spatial skills, their communication, and we're starting to develop some supports for their home activities.
UCF helps this group by coming in to conduct speech-language pathology services. When an individual has hearing loss, there is evidence that indicates the longer the hearing loss goes untreated, the higher the risk is for mild cognitive decline and dementia. So it's important to capture the screening early, then provide the treatment.
The UCF students in our graduate program come here to learn how to work with this population as they develop their clinical skills to be used in the field, but mostly to help these folks live as independently as possible.
If we find that there's a deficit on either end of the spectrum or anywhere, then the screening is going to identify whether or not that person can hear at that pitch or not.
There's a lot of factors that we want to control in this population, especially we want the hearing to be tested repeatedly.
I've worked with younger adults, so this is my first time really seeing older adults with hearing loss.
Today I learned a lot about the relationship between hearing and our cognitive abilities. On the devices, we are basically changing the frequency to see if they can hear low pitches, high pitches.
We were able to see what pitches they responded to, what pitches they did not.
As far as the cognitive screenings, we did some MOCA screenings today. We look at things such as language, memory. We look at visual spatial skills. We look at naming, short-term memory, recalling to long-term memory. We look at being aware of what's today's date, things that can give us an idea of where they are.
I really want the students to understand that a diagnosis is simply a diagnosis, and we're here to identify what is affecting the individual in their day-to-day life.
Be patient with older adults, and they might have to repeat themselves, but it's just that their brain is processing the information differently.
I enjoy helping people a lot, so getting to have these different experiences means a lot to me.
Everybody has a personality here, and they all want to be here. They all want to learn new things.
There is a mindset around what dementia means, and when they get here and they meet these individuals, they understand that they're still a person and that this doesn't define them, and they start to see that they can make a huge difference in their day-to-day, and that is so rewarding for me to see the students come out of here with a different perspective and carry it out after graduation.